All right, folks, if you could see us on YouTube, we are just getting ready to go live in front of our studio audience out in Zoom land. Bear with us, but you're in the proverbial green room with us. All right, I'm going to get us started. Have a great show. And if you need me in an urgent manner right now, you can certainly use the chat on our Zoom app. Just don't make sure you're not sending it to the entire audience. All right, here we go. Break a leg. Hello, everyone. This is Eric Laser, and welcome back to Bright Spots in Healthcare, produced by Bright Spots Ventures. We are dedicated to accelerating innovation through content, communities, and building connections. Our mission is very simple. We want to spotlight what's working in the industry and then allow you all and help you all to scale it. We bring together leaders each week from health plans, hospital systems, and other healthcare organizations across the land to share proven strategies that are driving measurable impact. And through our podcast, our private executive councils, we hosted one just yesterday, some of our private dinner events and our go-to-market strategy work, we surface and amplify bright spots in healthcare. These are proven innovations others can learn from and replicate because at our core, we want to foster trusted relationships that enable idea sharing, bright spot sharing, and fuel real progress in our industry. We truly believe the best way to improve healthcare in our lifetime is to find what's working, those bright spots, and then figure a way to clone those. If you have not subscribed to Bright Spots in Healthcare, you should be. You could fast forward through my opening each and every episode, so you don't have to listen to my voice, but you get access to all the great expertise and real bright spots that are being applied across this industry from all the guests we're privileged to have on the show. You could just go to Bright Spots in Healthcare, search for it anywhere you listen to podcasts, and click on subscribe. Speaking of great guests, I want to give a special shout out and thank you to our partner for this episode, Operationalize Health. If you have not heard of Operationalize, they were born out of Stanford University. They are a trailblazer, a true trailblazer in predictive analytics and artificial intelligence. I get to meet and talk to a ton of these companies, folks. Trust me on this one. You got to check them out. They're at prelizehealth.com. They are combining AI with deep clinical insight and delivering some of the most accurate and actionable predictions in the industry. I'll tell you more about them later on in the show. You can hear a lot more about some of the greatness that they are applying to our industry. All right. We have a really exciting show for you scheduled today. We have 4 unbelievable guests you see in front of you. We're going to put their bios, a link to their bios in the show notes in the podcast feed. And for you watching us live, we'll put it into the chat. Quickly in any order, our guests today are Ratnik Gandhi. He is the Senior Director of AI at Florida Blue. We have, coming back to the show, Dr. Ramala Batra. She is the Senior Vice President and Chief Medical Officer of Primera Blue Cross. We have Emily Allred. She's the Senior Director and Actuary of Large Group Pricing at Blue Shield of California. It's like an all-star Blues team here today. And last, and certainly not least, Dr. Dean Nobel-Tala. He is the Chief Product and Analytics Officer at the aforementioned Operationalize Health. So thank you all for being here. We're going to discuss the forecasting frontier and how AI is reshaping risk, revenue, and return on investment. This year, especially, like AI is, in my opinion, no longer just a buzzword. It's actually being used by everyone listening, probably in some way, shape, or form, even if it's just ChatGPT, is using AI, probably in a much more formalized manner, as a tool to reshape how we're not only operating today as healthcare organizations, but actually preparing for next year and the years beyond. What we haven't done yet, and we've done a lot of shows on AI, we haven't really talked about it being applied to price risk and combining that with clinical risk. So that's what's going to be really cool about today's discussion. We're going to combine 3 different vantage points Think of this sort of as the super friends of AI at health plans. We have one leader representing data science, we have another with actuarial expertise, and another with clinical leadership and expertise. And each one's going to show us how AI is helping them forecast more accurately, optimize decision making, and ultimately improve outcomes and value for both the consumers you serve and your own organization's financial health. I don't think there's ever been a time, at least since I've been doing this, that's more important that we think about innovation and zigging when everyone's trying to zag using some of these interesting tools. So here's how we've organized the rest of the show today. We're going to cover evaluation and pricing in the first segment. We're going to shift gently over to member and population impact, and then we're going to end with scaling and overall financial strategy. So we're going to connect all these perspectives so that you walk away with a really good understanding of new ideas, insights, or validating maybe what you're doing already around AI and risk, revenue, and ROI. All right, I'm done. Ratnik, let's get started. Ratnik Gandhi, Senior Director of AI at Florida Blue. You spend a lot of time, right, evaluating new AI tools. When you're deciding whether to scale an AI solution across your organization, what are the tests? What's the first test that it has to pass?
Sure. First, let me thank you for inviting me to this panel discussion. Wonderful experts here, and thank you to the audience. Great question. I think the pace at which the overall AI landscape is growing is very fast, and what we are observing is when we have to take a decision in terms of solving a problem, first we have to critically evaluate whether the problem actually needs AI solution, right? So I think that's the first cut that we have to appreciate in terms of evaluating if the problem requires AI or not. Once the AI is approved and agreed upon roadmap item ahead, the second step is evaluating whether the AI that we need is classical AI or machine learning, or we need to go towards generative AI, the new AI that we have. And in doing so, again, we have to sort of evaluate whether the problem inherently requires a classical classification type of approach, or it needs a regression type approach. Now, all of this, once evaluated, the strategy next thing is to look at the market out there and see what are the large language models available out there if you plan to solve the problem using generative AI. Now, critically evaluating those large language models is usually being done by large organizations with a dedicated team called LLM ops teams, or they have AI ops kind of a teams, which would typically spend a good amount of time not only evaluating those models against the standard benchmarks out there, because those benchmarks are not enough for the reasons following. Those frontier models are designed primarily from the perspective of generic knowledge available out there, and it may not be suitable for the type of requirement that you have internally within your business or in your domain. So at times, what we do is we actually identify and build our own benchmarks for evaluating this type of large language models before we decide on scaling our applications or solving a large problem for the enterprise using a specific LLM model. So I think there is a journey, and at every stop in the journey, we have different evaluation frameworks that we apply continuously to take a decision. The new generative AI space is a massively resource-hungry space, and we want to be mindful of the fact that it applies to the right solution that we have and is scalable enough within the organization, producing the value that we need from it. So that's the overall approach that we take in solving the problem.
Let me see if I caught this okay, just for our audience and for my note taking here. So we look at a problem. We need to determine, one, is it appropriate for AI? And if so, more of a traditional LLM or a generative AI solution. And then you do something. I think I'm putting words in your mouth, but I wrote down model validation, like to take a kind of a phrase out of the pharma industry. So we're gonna take the AI model and see if it could work for that specific problem. We're gonna stress test the accuracy, and doing all this before we decide to scale, and then
Absolutely.
it against the internal risk frameworks. Now, one thing you didn't mention, or if I didn't hear you dive into, I just want you to make sure we comment on it. What about let's pretend in this scenario the problem is AI appropriate. We stress test the model. It seems to be working. But what do we do? How do we think about workflows? And how does that play into a decision?
Absolutely. So I think again, the workflows, the business is old. Business is not new, right? So the workflows are very well established workflows. So the way we approach it towards this workflows is nowadays we call it a multi-agent framework because that allows a lot more flexibility for us to build those workflows in a non-rigid fashion. But those workflows are then intelligently automated with the help of AI and then optimized further to make sure that number of steps that we used to take without AI were 10, can we go to 6 and scale it at that level, right? So I think the approach is still not using AI just to intelligently automate some of these things, but to actually critically review it with the help of AI, optimizing it further to make and add more value towards let's say care scenario, right? I mean, one workflow can be in the care scenario, and we can actually just look at the steps that we have been taking classically and try and figure out a way to move to the next AI-based workflow solution.
Terrific. And by the way, folks, if you want to help me co-moderate, there probably is a little bit of time for me to integrate and sprinkle follow-up questions or new questions to our panel. So you could certainly use the Q&A module. Our regulars know we're not going to use chat for questions. We're going to use the Q&A module to keep us organized. I'm going to bring in Emily Allred out on the West Coast here, Senior Director and Actuary for large group pricing at Blue Shield of California. Emily, let's get into specific examples, right? Let's get into a real application. Can you walk us through an example where AI is transforming how Blue Shield is forecasting risk for your domain, large groups, let's stay there, and how that's maybe translating into a measurable revenue or ROI impact?
Sure, yeah. So my team sets premiums for large employer groups. So in my lines of business, a group starts at about 100 employees in California, at least. And at that point, that's when it becomes fully underwritten, and then it's largely unregulated. So we can basically use whatever we want to project forward within reason. And typically we would use a full claim history for our groups to project where we think the costs are going to land in the next year. And that's kind of how we set the basis for our premiums for the next year. But on the smaller end of the scale, so like I said, we start at 100, we go all the way up to 100,000 if we want. But on that smallest end of the range, the 100 to 300 employee groups, so they're not credible enough to use their own claim data, even if we had it. But for prospective groups, so those that we're hoping to get as new business, we don't often get any claim data at all. So they kind of come over blind. We might get a census, and from that we can kind of piece out some demographics of the group. So, we might know how old they are and where they live, but otherwise we're left to just kind of hope for the best and hope they act like our existing book of business. So that's where these highly predictive AI models come into play and really give us a leg up, because now we can kind of distinguish between, what's the average for those types of members and what may this group in particular cost in the future. So some of the new AI models are tapping into the universe of external claim data. So where the other competitor carrier may not be giving us claim data, it does exist, and we can tap into it and utilize it to help predict the future. But it's not just about accessing that data, because like I said, they're not fully credible at that size. So at that size, and then with healthcare in general, the cost can be volatile. So from one year to the next, AI tools help us kind of distinguish what of that data is actually predictive and what's just noise and what's random. So they help us, get closer to the pin in the future.
So you're using readily available third-party data that any of your competitors could use potentially to look at a group's history. But you got to distinguish between sort of the history and then what's random, what's predictable, and then be able to project costs. Are you building that model? How do you go about building that model? Are you bringing in a partner to build that model? Like, how are you getting to that level of sophistication where we actually have real impact?
Yeah, so a little bit of both, actually. So we have gone down the path of building our own models that rely on our own claim data to try to predict the future. But as we get into this space of using the external claim data, it became pretty apparent that our models are not as sophisticated as some companies that this is what they do day in and day out. We're actuaries, so we forecast a lot and we use claim data to make decisions, but when it comes to like isolating predictive variables, we know that we're not the true experts there. So we have partnered with a vendor to try to predict the risk of our groups as they come in.
Got it. And spoiler, that's pre-realized, right?
That is.
So if I just want to make sure because that sounds like magic. So I'm going to bring in Dr. Dean Noble-Tala, who is the Chief Product Analytics Officer over at Operationalize. Dean, so it sounds like Emily's got this sort of magic wand now, and she could use this magical thing called AI, and it feels a little bit like a black box where you're able to now take a group that you have very little, if not no any history with, and be able to predict accurately what's going to happen. Feels a little futuristic. So what's truly behind or inside that black box, and how is Blue Shield generating results right now?
Yeah, it's true. These models are a little hard to understand. So let me see if I can try to peel back some of the layers on this in a handful of minutes. So we got started by a couple of Stanford professors, as you mentioned earlier, Professor Arnie Milstein and Professor Nigam Shah, who really were emphasizing at that point in time, could they figure out who was going to be expensive in the future? They're not expensive today. We want to try to figure out if we can predict that future cost increase. Now, that was about 10 years ago. They were successful in that project. And what we've done since then is we've continued to leverage the research that comes out of the Shaw lab. And Nigam's lab really focuses on applications of AI in healthcare. And it's actually research out of his lab that informs the current model that does this sort of magical work that we're talking about, which we call Metis AI. And what Metis AI is it's a transformer model. It's also called a foundation model. And these transformer models have proven incredibly powerful in the advances that you've seen in AI. And that's what's underneath like ChatGPT. It's what's underneath Llama. It's what's underneath Claude. And what transformers are really good at is understanding sequences of information and then predicting the next thing that's going to happen in that sequence. And so it can be sequences of text, it can be sequences of images, it can be sequences of sounds. And what we actually are doing with Metis, though, is we build it from the ground up to understand sequences of events in healthcare. So we don't leverage an off-the-shelf language model or generative model. We build it ground up based on the research out of the Shaw lab to understand events and timing of events in healthcare. And it does seem kind of like magic. What's actually happening under the hood when the Blue Shield team is looking to understand the risk of a group in a low data environment is we're going and we're sourcing that data on that particular group. We can match roughly 87% of the people at any given data request that comes our way. We feed that data back into the Metis AI framework, and then we surface back multiple financial predictions and clinical insights on that group in the aggregate so that the people who are trying to set that premium have enough information to figure out how they want to assess that risk relative to their existing book of business.
Okay, so can you tie it specifically now to Blue Shield and how you're predicting how are you helping them predict in a way that allows Emily to price accurately in a way that wins the business and also keeps the organization above water?
Well, we have to do a lot there. I mean, we actually pull in information from Shield. We feed that stuff into Metis as a training exercise to get it to like really understand the nuances of their population and how they manage risk. so that we aren't just taking external data at face value and assuming that that's how it will perform when Shield manages that population. We have actually taught the model to understand how Shield manages their population, and we're applying that incoming data, filtering it through a model that understands that so that they can figure out what's it going to look like when it's a Shield group.
Got it. Okay, we're gonna come a little bit back to this later on. I want to keep us moving, and I want to get us now to the clinical side of this as well, because we have to match this now. So we're going to bring in our medical leader for the show, our chief medical officer of the episode. She happens to also be the CMO at Premier Blue Cross. That's Dr. Ramala Batra. Ramala, how has AI changed your approach for high risk members? Like, how are you identifying them first? Let's go there.
I think what's important for all of us to know is our world has evolved in risk stratification. It started with just descriptive analytics, like, what's happening. Then we moved on to diagnostic. Well, why is it happening? Then we have now moved on to a little bit more of predictive. When will it happen again and to who? But where we need to get to is, and what should I do about it? So plainly said, if you think about a risk stratification approach, we want to know who's high risk. But more important, we want to know who's rising high risk. So yes, we want to get after people who are high risk or highest risk. But more importantly, we want to go upstream. As a primary care physician, I feel like prevention is better than cure. How about going upstream and finding out not only who's rising risk, but what can we do about it? I think that's the most important piece. A, how do we identify it and what can we do about it? So for us right now, we're really focused on both those areas, the highest risk. And so that's where we have programs like palliative care. We will have programs around complex case management. We will have programs around behavioral health management. But then we are looking at rising risk and figuring out what are the conditions that are going to tip them over. And that's where risk stratification becomes super important. So for example, if somebody has a heart failure and diabetes, and they also have behavioral health condition, not only do we want to know their high risk, but we want to know which condition is going to tip them over, where they're going to end up in the ER, or they'll end up in the hospital, or they'll have like unraveling of their chronic condition. And that's where our focus has been in working with organizations internally and externally in bringing to bear and testing and trying out those kind of models. So we've been along this journey for a period of time. As I'm saying, we are more and more thinking about the next best action. And this is not only clinical care, but other areas too, is, okay, we find them, how are we going to engage with them? And what is the action we want them to do? So if you're a human being, you have 8 conditions. We cannot ask you to focus on 8 conditions. We need to know which one's going to tip you over and what is the next best action our case manager can work with our member in helping them achieve, get to the next level.
And as you're looking at it, I know you're like sort of in, you're not able to necessarily always look at the forest beyond the trees, but as you're in it right now, are you seeing, if you think back to your days at your previous employer or Scan or anywhere else, like, do you see the evolution of impact? Are you guys doing a better job at Primera now, effectively identifying the right members in the rising risk populations and then finding the next best action and then getting them to take it? Do we have any data yet?
So I would say in terms of evaluating the next best action, we are still in that journey of evaluating. It'll take us a little bit. But what I would say is one of the proxy metrics we use, and we call it a leading metric, is engagement, right? If we cannot engage with our population, there's no next best action that's going to happen. And so we've been really focused on, are we engaging and what our engagement rate has been? And over the years, we have seen the increase in engagement rate because as we are creating these tools, we're also saying, how are we going to engage these members, right? Are we going to engage with them over a phone? Are we going to knock on their door, engage with them in their home? Are we going to engage with them digitally because we have, multiple digital health apps? And so what we are really focused on is first get them to our model, which is engagement rate. And I would say, yes, that engagement rate has been improving. Would it then translate into the next best action, which our teams are kind of broaching and engaging member with? And would that lead to the outcome? So that's still a journey that we are on. And I would be super bullish to say, yes, it has happened, but it's a journey and we are kind of progressing well along that journey.
Okay. So I want to actually ask you about modalities and outreach, and how you're thinking about folks in and how they are engaging differently or not. Before I do that, I just want to do just a quick little pause and PSA. Next week, folks, we're taking the Thursday off in part because of the long weekend in the US, Labor Day, long weekend there. But we are going to do 2 shows. We're doing 2 shows the following week. So I just want to tell you about them. And if you want us to register you, happy to do that for you on Wednesday. Normally, we don't do a show at Wednesday. We're actually doing a half-day virtual summit. It's something we do 2 or 3 times a year. It's on ROI-centered care and around building new strategies in healthcare. We have an incredible group who's going to both speak and be on a panel. I'll be moderating and sharing it. It goes from 11 a.m. to 2 p.m. on the East Coast, and we'll register you that, no charge, if you want to join us for that episode. And then on Thursday at our regular time, 12 p.m. On the East Coast, 9 a.m. on the West, we will have our hour-long show doubling down on Medicaid innovation. And that will be a really interesting angle on how companies are thinking differently around their CBO strategy and taking sort of the CBO assets in their community and I'll call it militarizing them into a business, and how to do that, how to take churches and community centers and other non-for-profits and make them part of your business in a way that makes sense for them and for you. It's going to be a really interesting conversation and one we don't get to have very often. So excited about that on Thursday, September 11th. So Dr. Batra back. So if you want, by the way, folks, if you want us to register you, and you're watching live, just click on the poll and we'll provide some links to register if you're listening to the podcast right now. And you could just, while you're on your walk or at the gym, wherever you're listening to us, click on it to register. So Dr. Batra, we were talking about, like, I want to think about how AI is shaping your ability to pick the right modality of communication and your timing of this rising risk so that, just get more into the weeds about that next best action goal.
Yeah, I think what we are really focused on is looking at our population, stratifying them based on highest risk, rising risk, medium, and low risk. Once we get to the highest risk, as you can imagine, every organization has X amount of bandwidth. If I had a magic wand, I would reach out to every single population. But given the focus on high risk and rising risk, what we are then double clicking and getting data and information based on tools that you've heard on the panel so far is around which modality is most likely to engage you. So how could I engage with Eric? Would he pick up the phone, or should I send him a app where he can follow or create his own journey to improve his diabetes, or he's not going to engage with us either of those modalities, then which behooves us to think about and what else can we do? And so with that in mind, as we are creating our care models, there are multidisciplinary care models that we have created. How do we manage populations telephonically with case management? Because we know, you're going to engage with us telephonically. How do we create a new model, which I call boots on the ground, in partnership with other, partners, vendors, hospital systems, where people are not going to engage with us either telephonically or on digital apps and go there. And last but not the least, for people, I'll use myself an example. I don't want to pick up the phone at 9 a.m. on a Monday when I'm working. But yes, if you send me a link that tells me a better way to manage my diabetes, which we have so many tools right now, that is the journey that I want to be on. And so that's where our focus has been. And what we are trying to do is we are trying to monitor our engagement rates in each of those omni-channel modalities. Like, what is our engagement rate? If the tool told us Robin's going to engage with us over the phone, did that happen? What is the engagement rate? Is it better than 2 years back? So that's the journey we are on. I would say we haven't done statistically significant stuff yet, but we know directionally speaking, our engagement rates are improving year over year.
Well, Ramal, I'll tell you, if you call me and I see your name on my phone, I'll pick up. I promise. How are you? You mentioned tools that others have mentioned. Are you guys also? Are you using an AI partner as well to do all this, or are you guys doing some of this on your own as it relates to population health?
Yeah, it's a collaboration. We work with Dean very closely. So Operationalize, PSA for Operationalize there. So yes, we've done that for many years. In addition, we are also using some of our internal tools and building capacity and capability. So I would say it's a combined effort.
Dean, you're Mr. Popular today. Let's go.
I'd be remiss to say the teams that these health plans are excellent to work. I mean, they're just amazing, phenomenal teams across the board. It's not a us in isolation. It's a real collaborative effort.
Yeah, we should probably break that down. What makes the collaboration? That's another episode. Let's my production team mark that down. So speaking of that, I gave myself an interesting opening there. There's a few open dates this year that we're thinking we haven't landed on topics yet for, and we rely on all of you who are listening and watching to provide us that guidance. So at 12:45 on the East Coast, 9:45 in the West, we'll send you another email with survey link. Everyone knows it. We're actually changing it a little bit, folks, if you take it for us regularly. And if you are listening to the podcast, we'll put a link in the show notes. And if you're watching live, we'll also put a link right in the chat. But if you want to give us some feedback, not only about how we're doing today, but certainly the topics that we want to cover, that would be really helpful as we get through sort of the end of the year here. I know it doesn't feel like the end of the year, but for us it is. Rotnik, I'm going to come back to you. Rotnik Gandhi, he's running AI for Florida Blue. Last week we talked earlier about how you think about problem solving and whether LLM or generative AI or whatever should be the right solution. So you're thinking about the problem first and what's the appropriate solution. We talked about workflow. What about now a specific example, like maybe an actual bright spot at Florida where AI is making a meaningful difference for your care teams or your members?
So I think in the journey, when we are looking at a specific business problem, I think I think most of these organizations, everybody sitting here would also agree to the fact that AI is great, but bringing data to AI and providing the right context to the AI solutions is very critical. And so what we have been observing is in some of the cases, for example, when a claim comes for processing, right, or some medical documents are required, currently some of these processes of reviewing these medical records are significantly manual, and it sort of is it's a process that we can definitely improve with the help of generative AI. So what we are right now doing currently is benefiting from generative AI to not only understand the documents, medical records that have been brought in, we bring it in with the help of this system called retrieval augmented generation, or alternately called RAG solutions. We bring relevant information to the reviewers, the view with the help of natural language conversations. So they don't really necessarily have to review all the documents in a sequential manner, but they can now actually have conversations with those medical records, and they can ask questions, and these tools are actually retrieving information for them. Now, how can this be useful in future? Let's say post clinical care, right? So let's say I have a nurse practitioner who needs to make a call to my member and try and have a follow up. I think if they are making 100 calls a day, the context switch becomes very difficult, right? So now what they can do with this RAG-based contextual data, they can actually prepare and actually have live stream conversation with the tool to have natural language interface and ask questions while they are on phone with our members, and have a very meaningful, very contextual conversation without having to actually do this work in a linear and laborious manner, right? So I think what we are doing is we are trying to operationalize the data that we get through our through the input from providers. We are operationalizing it against the generative AI space that we have, and making sure that it's easily accessible for our community. And in doing so, I want to sort of open a hood slightly here and say that the retrieval of relevant context is a very tricky business. And if you again go with off-the-shelf models at the time, it may not do the right job. So what we do is we carefully choose embedding models, which helps you actually understand those medical terminology better, and help you pull the information back in the most relevant way when it is needed. So this is something which is under the hood, but I'll pause here and not spend too much time talking about the under the hood items.
Let me see if I got that right. Keep me honest here. So we're taking the challenge of medical terminology and context. At the end of the day, I think what we're trying to do, the goal here, correct me if I'm wrong, is very on par with what Dr. Bach was talking about getting folks to take the next best action. So what we're trying to do, we have all these different steps. We need the care team to make a post-operative follow-up call. How are we going to get them a quick summary for this specific person through the medical records? And you're using an approach called retrieval augmented generation, is what you said. Did I catch that? Or RAG, so I could sound cool. And that solution allows the care manager or the outreach person to understand the medical terminology a little bit better and explain it in layman's terms to the member that we're calling. And in doing so, hopefully enables them to inspire that next best action. Just take Dr. Bach's term and just steal it, and that next best action, and get them to do the next best thing they have to do after discharge, post-op, or whatever. Did I capture that more or less?
It's absolutely spot on. And in fact, when you say layman's term, I think, for example, the medical record might call it, and I'm just using simple terminologies here, is let's say they might be calling it flu, or I might be using it as cold, or somebody is using it as sneezing. I think all of this terminology are interlinked somehow. And so when you are performing that retrieval information, you want to be not aware of the specific word or verbiage, but be more generative, natural language interaction, so that you can pull up the information very easily, quickly, which is in the same context, and be meaningful, having a meaningful conversation.
Great, awesome. I'm going to toggle back next. We're going to start talking about scaling a little bit and financial strategy. So we're going to toggle back now from the clinical stuff and go to the finance stuff now. And I'm going to bring back Emily Allred, who runs large group pricing at Blue Shield of California. So Emily, when you're thinking, you gave us sort of the beginnings now of how you're pricing more innovatively for your large groups. When you think about AI's role overall in your financial strategy, what do you see, where do you see it having the biggest impact maybe in the next year or 2 years down the road, because things are happening so fast?
Yeah, so I do think it'll continue to aid in pricing and forecasting, the same problems we've been trying to get better at for years and years and years. Especially as the predictive modeling keeps advancing, I think it'll continue to remain very important. But another big need that we have in the new AI-driven world is really just to keep up. So things are moving so fast, and we need to be able to get to key insights and information quickly to be able to answer our customers' questions, fully support our members when they need it most. So we're actually tapping into AI to supplement our data and reporting tools. So to kind of round out the financial portion of my role. So we've got AI now integrated into our dashboards and our reporting hubs. And we're working towards giving our analysts the ability to kind of chat with the data. So with that, we've got some guidelines that we're setting up. We want to make sure everybody has the same consistent data. We want to make sure it's accessible and structured effectively so that they get to the right answers. And then we know that it has to be tied to a single source of truth. So it's not just solving the healthcare problem, but it's solving how do we meet our customers' needs in this fast-paced environment that is rapidly changing around us.
Okay, so I like what you said, enabling our analysts to chat with the data. So it's more of the democratizing of all the data, the one source of truth, and then providing a easy to consume, I'll use the word dashboard, tell me if that's off, place for everyone to look at it and then be able to interact with it so that you could get more information.
Exactly.
Could you give an example maybe of where that's being put into practice with what you guys have to do every day, whether it be just looking at the books or maybe it's working with your providers and negotiating with them? How is it being put into application?
Yeah, that's a great one. So recently, and as you guys all know, provider negotiations get very heated. They get down to the wire. So there's not much time to evaluate the proposals and counter proposals with provider contracts before you really risk pricing your members out of a product or losing a provider from a network altogether. So it's very critical to have fast information and accurate information to assess those contracts. So we've been using our reporting hubs, our dashboards and data to be able to quickly drill down into that data to assess the member impact so that we can adequately or we can give our contracting teams the right information to be able to go back and make an educated adjustment to the contracts or, to agree to it if that's the right thing. So through our tools, we can drill down to regional impacts. We can actually get down to member level data to see, who's going to those providers today, and is there a nearby provider that we could switch them to if needed to on the fly. So it's really having that real-time data at our fingertips. But behind the scenes, we have to make sure that it all ties to the financials so that we're going at it with accurate information.
Love that. That's really interesting. And I it struck me when you were talking, I almost forgot. I've been so into this conversation, and instantly I'm taking notes, and we're going to take the AI summary from today's conversation and the transcript with my notes. I'm going to send everyone out a key insight summary. I think on Tuesday, maybe Wednesday with the holiday. Don't quote me on that, but everyone who's attending, this comes from the survey that you guys complete every episode for us. We'll be sending that out to everyone. It strikes me that I forgot to remind you guys about what Operationalize does, and I want to give them their due. They're an incredibly important partner to Bright Spots, and because they're so cutting edge and so pioneering around AI and how they're transforming healthcare from proactive. We've done a lot of episodes on population health and predictive analytics, but now I think we're finally beginning to cross the chasm on true proactive health that's reducing costs and enabling people to live healthier lives and take that next best action. And Operationalize is partnering with health plans. A couple of them are on the show today, and it's working. Right. These plans, it's working. The AI and the expertise that they're bringing to these organizations are helping improve members' lives and helping improve the health plans' ROI, their overall fiscal health. So if you're looking for help to identify rising risk members, get earlier target interventions, help with on the actuarial side around pricing, this is an organization that has the technology that came out of Stanford that just doesn't forecast risk, but helps operationalize it, whether it be underwriting, care management, member engagement. They do it all. You can check them out at prealizehealth.com. One of the things I think could be really useful for everyone, whether you're in a decision-making capacity to bring in new tools or whether you need to be better enabled to have conversations internally with your IT team, your product team, is to really just get a 101, 102, maybe depending on who you are, a 103 on AI in these areas. And so what we're going to do today, which is something we haven't done yet, is anyone that's attending live and wants to get a free kind of 30-minute AI consulting session with Dean, we're going to set that up. So if you want, it's not a sales, you're not going to talk about pre-licensed products. You're going to ask him questions ahead of time. We're going to help schedule it for you at Bright Spot so you don't feel you're going to get bombarded by a sales team. We're going to help you get Dean prepped with questions you're going to ask ahead of time. We're going to schedule 30 minutes. Probably it'll take about the next, call it 2 to 6 weeks to get everyone scheduled. But if you want a free consulting session with Dr. Novatala to just learn more about how AI can be applied and ask questions that you may have about AI, whether they're 101 questions or 103 questions, we'll schedule those out for you guys. You don't need to talk about pre-licensed products and services. You can just tap into the incredible insights that Dean has and his expertise. So we'll do that for everyone. Dean, since I've been talking about you, why don't we bring you on next? As more claims data is rolling in, how have you seen that impacting forecasting accuracy, and how are plans sort of using that to refine their strategies during renewals? Could you just kind of give us a high-level strategy session there? Maybe even an example of another plan that maybe isn't represented today on the panel.
So, what I mean, kind of have some obvious advantages once we pulling in data, we're generating all these predictions across your population, like 50 plus predictions for every single individual, and continuing to learn as new data comes in. So things change, obviously, with your population over time. You pull that in, you're still able to identify those changes and predict forward. But what I'd say that we are seeing in the particular environment that we're in right now is that plans are really laser focused on finding those strategic opportunities to improve medical trend, right, and stay on target, right, for their things they've already signed up for in 2025 and things they've already even signed up for in some cases, in some lines of business, all the way into 2026. And so in order to like empower that kind of data-driven decision making, we've partnered with our customers to develop a medical trend opportunity analysis report. So think of this as like surfacing up all the at-risk cohorts that we can identify at the population level and bumping that up against an assessment of what kinds of risks can actually be mitigated and with proactive intervention, right? To identify like 1 to 3 strategic opportunities, right? Because you're not, this Ron was pointing out earlier, you don't have the capacity to do everything. That's just not the way this stuff works. And so we've been working with our customers to generate that kind of reporting, but then also to do that next step, which is let's find those recommended next best actions. So this is another layer that we're building on to Metis AI that makes those recommendations. And it's really driven by input from our customers, specifically one in the Southeast that wants to see, how are we going to create recommendations that prevent people from ending up in the emergency department? We're super great at identifying them up front, but let's identify what you should do about them at that same time. That's going to involve a lot of collaboration with their clinical teams to build that out. That's not something you can just do in isolation, right? Different plans have different capabilities. They have different ways about thinking and managing those risks, different programs that they run.
Great. Just in full, I'm not going to reveal the plan, but it's not Florida when you say Southeast. So I just want to make sure about that. We're not misrepresenting. And speaking of Florida, Rotnick, we've seen, everyone's seen promising pilots stall, right? What does it take to get a pilot to go from pilot to production inside one of the biggest Blues plans, in the country, and maybe provide us, can you put it like, tell us a story, tell us a real life example?
Great question. I think, in fact, if you look at some of the news articles surfacing in last few months, I think there's a lot of discussion around AI pilots failing significantly, and they do not scale and go to production. So I think, as far as our organization is concerned, we are doing a very careful and calibrated sort of taking steps towards transforming our journey in the AI space. We actually start with pilots, but then we have our legal, data protection, information security, data security team always sort of very much involved in all of the discussions that we have, including we continue to sort of have a very good AI governance where we, for example, one of the great risk framework that has been released recently is called MIT AI Risk Framework. We review it, we actually score it for ourselves and make sure that the capability that we are building is continuously evaluated against all potential risks. And so I think one of the most important things is to do the responsible AI development, and I think we are doing it in a responsible manner. So, for example, I think one of the proof of concept that we have been working on for some time, before going to production, we had some of these concerns. We worked with various groups, including the data storage, right? So if I have a conversational tool, for example, when we just talked about, let's say, a tool where natural language questions can be directed and the tool actually returns with the specific summary and context. Can I actually store this natural language question in a regular database, which is of course secure, or it has to go and live in a SOC 2 environment, kind of a question, right? So I think asking this question is helping us go from pilots which are really actually worth significant value add, and we are actually going from responsible AI development lifecycle, including appreciating the risk the AI brings in solving some of the problems within our organization and scaling it to production. So all in all, risk, responsible AI development, technical maturity, and all of that coming together with the help of legal, data protection, and other collaborative efforts to take it to the next level, ultimately improving the member experience and helping them benefit from the new AI for their health.
Right. Got a couple more questions, important ones I want to get in here before we close out. While we're doing that, I mentioned at the beginning, a lot of what we do at Bright Spots Ventures is about building relationships. So we do more than this show for the industry. We do a lot of private events as well. We have 2 coming up. Both are for health plans. So if you work at a health plan and you want to get into a off-the-record private discussion that I will facilitate on how smarter risk adjustment is fueling MA growth and talking about AI and risk adjustment, we're doing one on Wednesday, September 17th at 12 o'clock. That I'll be hosting. That should be really interesting. We already have a bunch of folks confirmed for that. And then if you're at a health plan and you want to join what we're calling a sprint lab, and it's also tied to this topic around engagement and next best action and how health plans are converting behavioral data into stars and satisfaction numbers, I'm going to be facilitating a private discussion amongst health plan leaders on September 24th at 12 o'clock. And if you want to come to either of those, you could just click on the poll and we'll make it happen. Emily, so many vendors are pitching AI. How do you separate credible solutions from marketing hype, and like what processes are you using to decide which tools are or approaches or trust? Like, how did you know that Dean wasn't full of it?
Mm-hmm. Yeah, I would say first and foremost, it really is the relationship. So finding that true partnership in a vendor. So a vendor who believes in their model should have no problem letting you ask the tough questions and explore the data together. So it really should not be this like black box where you don't really get to understand what's behind the curtains. So risk vendors, they're trying their best to prove with as much certainty as they can that what the models are predicting will actually come true, right? Like that's their business model. But we're really trying to do the same thing in how we assess the vendors. We have to set those premiums and we have to set them as accurately as we can. So we have the same goals. We're both trying to get, to maximum accuracy, maximum predictive power, maybe for 2 different reasons, but we're going at it for the same goals long term. So in our case, we did a full evaluation on several predictive models, so including some homegrown ones. We used our historical data and we were able to tease out the ones that had the most predictive power. In our case, Prelize was without question the most accurate on any of the things we tested. So we did a big pilot study and an actual versus expected study, and they were great in the accuracy department. But from there, it really goes back to that partnership, because AI, as we've all mentioned, AI is rapidly changing. So you have to find a vendor who's willing to keep up with that, but also want to keep evolving the product so that their solutions meet our needs, sometimes needs that we don't even know will be coming in the future. So it's working with someone who is going to keep you relevant, I guess, as the world keeps changing.
And you put them out in the field and they are what the record says they are, basically, is what you're saying.
Exactly.
Dean, there's so many tools out there, and some of them are maybe off the shelf intuitively, for most of us listening, we think less expensive. I don't know if that's true or not, but like, what's the real advantage of custom trained models for health plans, and what risks do you see if leaders and people listening are relying on off-the-shelf AI?
I'd point to something I think Rotnick was mentioning earlier, which is that there was a report out last week that 95% of all the AI initiatives in corporate America, this is from MIT, are failing, right? But if you get underneath that headline a bit, what you find is that there are...
The study was from MIT. The AI models that are failing are not from MIT.
Yeah, fair. Yeah, I don't want to present it that way. Study was from MIT. not the models. But underneath that, like headline, right? Like one of the bright spots in there are companies doing four specific things, right? Like, so one is they're using purpose-built technology, right? Don't use generic models trained on the internet or some other data source that's not relevant to your business. They're in heavily regulated sectors. I don't think that's a surprise that healthcare is one of those. They purchase, adoption, and deployment process is heavily involving like the line managers who are, or even they own it. We're like really close to the actual work that we're talking about implementing the solution for. And then the last one is that they're using a specialized vendor to support the development of the AI tools and the implementation of those tools, because it isn't something that is very easy for an organization that already has a lot of other capabilities to necessarily spin up, right? Like this, Emily was noting, this stuff moves so fast that you really have to have a, like, it's all we do all day, right? For our organization is like understand the latest research and how do we translate that into something that improves our technology and our ability to identify future risk. Right?
Yeah, I love that. I think people have to map out their strategy. By the way, if you did not answer that poll, if you want a meeting and a free consulting session with Dean, you could hit me up, DM me on Zoom right now, or email me at eglazer@brightspotsventures.com. I'll take care of it and get you scheduled. Last question, just looking at the future here a little bit, Ramala. Let's talk about 6 months from now, and let's talk about AI and your clinical operations. Like, where do you see at Premera the biggest impact or the biggest changes being made? Utilization management, claims, member services, all the above, none of the above, something I didn't mention.
I think our focus, we are not for profit plan. Our focus is members first. How can we make this experience, use AI to make the experience better? And so with that in mind, if you look at it, and you must be under a rock if you don't hear about prior auth is a big area of focus for us. We are building newer AI ML models that can help us say yes faster. So 20% of our services that require prior auth are now kind of backed by AI engines, so as to say yes faster. No human needs to touch it. We get it, we say yes faster. And our goal is to keep building on those models to go from 20% to 40% to 60%. The second thing I would say is so many people call us to customer service every day, and it takes a while for our customer service folks to help these members. So how do we engage our members when they call customer service with very on your tips, next best action kind of a thing? Because the poor CSRs have to go and figure out what the member wants. And I would say even becoming more proactive, like people reach out to us asking what benefits and how to understand them. What if we reached out to them? So a huge roadmap around what I would say is member services, huge roadmap around with a focus on prior auth, and last but not the least, claims.
So that was great. And wow. Yeah, I'm gonna quit while we're ahead. There's a couple of questions I wanted to throw in here, but I'm afraid that'll get us going long. So what I'm gonna do is thank you all. Couple minutes early. We'll keep in mind more. Really appreciate all the time, expertise, preparation for today's episode. Really appreciate it. To everyone watching and listening, would you not take the time you spend with us for granted? So we thank you for being with us for this hour, and we hope we use the ideas, the bright spots shared today to inspire your thinking, enhance your company's current approach to improving healthcare. Maybe you take some of these bright spots and go with it. We will send you all what we call internally a KISS, which is our key insight summary from today's episode. That'll come out Tuesday or Wednesday, typically Tuesdays, but it is a holiday next week. And thank you again. And we'll get all of that to you. Recording will be up on our YouTube channel in moments, and we'll also send you a link to that recording when it's available. We'll be sending out the KISS, and the show drops in your podcast feed on Tuesday. We produce the show for all of you. And remember, please, this is your Bright Spots in Healthcare podcast. Thank you very much, everyone. Take care. Have a good rest of your day.